right, good evening. Thank you. Thank you, Dr. Brothers, for sharing your story. Your example reveals morality's unsettling implications, as well as the challenge of conflicting moral obligations. Sometimes we cannot avoid causing harm, no matter how hard we try to prevent doing so. So tonight I'm here to talk to you about the nature of impossible choices. I decided to pick this picture as my title to illustrate what I think of when I imagine moral goodness. It is out there, but often far away, hidden in the darkness. Please keep this picture in mind as we make our way through tonight's talk. All right, so welcome to a mini crash course in ethics. Understanding the basics of ethics is essential for healthcare workers. Diagnostic skills and knowledge of the body are not enough. Being a good provider requires a moral education as well. Moral philosophy, or ethics, I'm a moral philosopher, is the study of right action. Ethics is a branch of philosophy that studies what principles and values, moral ideals, should govern our actions, examines what sort of life is worth living, and investigate how we ought to treat each other. Ethics is a discipline that seeks to respond to and resolve conflicts that affects people's rights, well-being, interests, and personal and professional relationships. Ethics provides us the tools to pursue a larger goal of living a good life. Moral conflicts are an inevitable part of life, especially in healthcare. Situations can become particularly stressful when duties clash and no easy answers seem apparent. Sometimes a resolution is possible, such as when we negotiate an alternative by fulfilling one obligation and finding a way to make up for the loss of the other obligation. Sometimes we can recognize what's right and what's wrong, but the situation constrains us from doing good and avoiding bad. Situations like these can provoke anxiety and distress. Now, most moral philosophers or ethicists defend morality's action-guiding powers and conflict resolution strategies. When faced with a conflict, ethics provides us with the resources to resolve the problem. Pretty great. However, what happens when morality cannot tell us what to do? What do we do when we're set up to fail? It is this question that is at the heart of my talk tonight. The good news, there's hope. The bad news, well, you'll see. All right. So if you've ever taken an ethics class before, then you are probably familiar with the trolley problem, which is a philosophy thought experiment, first presented by contemporary philosopher Philippa Foot. Now, philosophers love thought experiments. These are imagined stories. They aim to provoke us to ask what-if questions, and they engage our creative and imaginative capacities. Now, thought experiments also can really surprise us. They keep us asking questions, especially challenging questions, to make a point, and often to test a hypothesis or some kind of assumption arising from conventional wisdom. So now onto the classic trolley problem. Imagine that you are the driver of a trolley that is speeding down the tracks. Up ahead, you see 5 people working on the tracks. You try to stop, but you can't. Brakes aren't working. As the trolley hurtles down the tracks, out of control, you know those 5 workers will die. Then, all of a sudden, off to the side, to the right, you see a side track. You can turn the trolley off to the side track, but there's a worker on that track too. Time is running out. Do you kill the 5 or do you kill the 1? What should you do? Trolley problem version 2. Now, consider an alternate version. This time you're a bystander, standing on a bridge overlooking the tracks. You see a trolley racing down the tracks headed towards 5 workers. Once again, the trolley's brakes are not working. As you watch the trolley, you realize that 5 people will be hit and killed. Then you notice a heavy-set man standing next to you on the bridge. You think, you could push the man over the bridge onto the tracks, obstructing the trolley's path, averting it from hitting the 5 workers. Well, as it turns out, you could throw yourself over the bridge onto the tracks, but you're not large enough, so you wouldn't be able to obstruct the trolley, and you and the 5 workers would die. Is it okay for you to push the man on the tracks? What is the right thing to do in this scenario? All right, so in the trolley scenarios, you have a duty not to kill 5 workers, and you have a duty not to kill 1 worker. You also have a duty to save as many lives as you can. If you think that it's okay to save the 5 at the expense of the 1 in the first case, then why not push the heavyset man over the bridge in the second case? Surely it is cruel to push a person to their death, right? No denying that. But it's also cruel to kill an innocent worker with a trolley car just because they happen to be in the way. Either way, whatever scenario, somebody is going to die. What does morality require of us in these situations? Well, morality professes to save us by offering us action-guiding principles that claim to resolve or mitigate situations in which a conflict is present. An underlying assumption about morality is the view that ought implies can. Morality can't require you to do what is impossible for you to do. If you cannot fulfill a moral requirement, right, then it must be impossible. So ought implies can. And it's unfair for morality to require us to do something that we cannot do. Morality provides us governing principles of action that we can achieve. Morality is authoritative and provides us the tools that we need to resolve apparent conflicts. For example, a utilitarian would tell us to save as many as we can, right? Maximize the greatest amount of good for the greatest number of beings affected by the act. Now, in contrast, though, a deontological or a duty-based approach involves a conflict resolution strategy that tells us not to push the heavy man over the bridge. That is, we must not violate our duty. We must never use someone merely as a means to an end, even if 5 people will die, and no matter how good the outcomes might be. Morality can save us from moral failure, and moral goodness will always prevail. So remember the picture, looking out at the starry sky. Okay. All right. Oops. So here is a trolley-like scenario fitting for the healthcare environment. Say you have a patient, you have 5 patients in need of organs, right? 2 patients need a kidney, 2 patients need a lung, 1 needs a heart. What if you could save 5 lives by taking the life of a healthy patient who just happened to walk into the hospital? As it turns out, the healthy patient is a match for the other 5. What does morality require of you in this situation? Clearly, you have a duty to give aid to your patients. You are obligated to help them to the best of your abilities. To add to this, as a healthcare provider, you have additional moral demands placed upon you to work in the best interests of your patients, to provide care, to alleviate sickness and disease, to minimize suffering, to promote advantages over disadvantages, to be just and fair, and of course, to do no harm. So morality tells us the right way to treat each other. We must save as many as we can. We must produce the best state of affairs and maximize the good. We must never use people as a means to an end. We must never thwart another person's autonomy. We must not kill innocent people. And we must do no harm. We are all familiar with these moral requirements and their governing power. They organize and direct our actions and our pursuits toward the fulfillment of certain ends, specifically morally good ends. They always tell us how to act, don't they? All right, so of course it's the case that trolley problems and their counterparts are artificial, made-up scenarios that we philosophers use to illustrate big ideas and ask big questions. And they also allegedly tell us that moral conflicts can be resolved. They also deny the possibility of genuine moral dilemmas, situations in which it is impossible to fulfill moral requirements. So now let's consider a real-life scenario. This is testimony by a Holocaust survivor, Celia K. I will warn you, you're already reading it, but it's tragic and horrifying. I might cry. I cried during Sophie's Choice, so I'll cry again. Okay, we were all a little group of Jews in the woods. I ran into a group of Jews, maybe 12, 15, and there was a cousin of mine with her children, a little girl of 4 or 5, and a little boy of maybe 8, 10, 11 months, and he had a voice. It was such a raspy voice. It was impossible. And in the woods, when a child cries out, it really rings out. And the Germans would really come very fast. So the group of Jews said to her, "Look, Titel, you can't be in the woods with this child. Either get away or kill him." She became wild. Anyway, she had to do it. There was no choice. She had the little girl and herself to think of. I saw her put the child in the swamp. With her foot on his neck, she drowned him. I saw it with my own eyes. And that wasn't the only isolated incident. There are a lot of incidents like this. In Titel's situation, by killing her child, she would save the rest of the group, as well as her other child. On the other hand, if she did not kill her baby, then everyone else would likely die, including herself, the baby, her child, the rest of the group. She has a moral obligation not to kill her baby. She also has a moral obligation to her other child and the rest of the group. For Titel, what is the right thing to do? In this case, both utilitarians and deontologists or duty-based thinkers, they're going to provide us similar answers like those given in response to the trolley problem. Think about moral requirements such as save as many lives as you can. Don't use people against their will. Respect human beings' capacities as autonomous decision makers. Do no harm. Promote the good. However, given these moral prescriptions, does morality prevail in guiding Titel in this situation? Is it okay that she killed her baby? What if she did not? Is it okay that she risked every member of the group in the woods? Who should Titel choose to save? She can't save everyone. Is it okay to kill an innocent life in order to rescue another? Should she have done something else? If so, what would that something else have looked like? In this case, no matter what Titel chooses, someone will die. We can all defend saving more than less lives, and we can all defend not taking an innocent life. We have good moral reasons for each course of action, yet they are all incompatible. Titel cannot save the many and protect an innocent life, that of her baby. It is wrong for Titel to kill her child. It is also wrong for Titel to sacrifice the group. But do these moral judgments really capture the gravity and impossibility of her situation? Can morality truly resolve conflicts like these? Does some moral obligation rise to the top and outweigh the other obligations? If so, which ones? Why? When? Okay, I just threw a lot of questions at you. So here's a big question. What does moral goodness look like in Titel's situation? Clearly, as we can see, doing the right thing is not always easy. Sometimes moral goodness is not victorious. Sometimes goodness is defeated, and its demands are impossible to satisfy. Things are going to start to get better soon, I promise. Okay. So in order to understand the moral complexity of the case and the nature of Titel's decision, a helpful distinction is in order. We need to better understand moral conflicts in order to figure out how we can hopefully resolve the problem. First, a moral obligation arises when a person has an obligation to do A and an obligation to do B, but they cannot do both A and B. Some moral conflicts can be resolved, and some are negotiable. I'll talk about that in a minute. However, some become moral dilemmas. A moral dilemma involves a situation in which a person has an obligation to do A and an obligation to do B, but they cannot do both A and B. Neither A nor B cease to be moral obligations. So, unlike in a moral conflict, a moral dilemma occurs when A and B are incompatible and you can't compensate for the loss. Something of value is going to be lost no matter what. So consider the following example of a dilemma. Say a patient asks not to be resuscitated during their next cardiac arrest. Later, the patient codes and the family demands the patient be resuscitated. First, as the provider, you have an obligation to honor your competent patient's wishes. Second, as the provider, you also have an obligation to honor the family or the surrogate decision maker once the patient becomes incapable of making a decision. Neither the duty to honor your patient's wishes nor the duty to honor the family's directives cease to be a moral requirement. Nevertheless, they're incompatible. You can't fulfill both obligations. Of course, the law requires, right, you're going to honor the family's choice now that the patient is incapable of expressing themselves. But it seems like the dilemma remains because when you resuscitate the patient, you commit a moral failure by violating their wishes. Indeed, in a case like this, dilemmas are even more stressful because of the competing moral, professional, and legal obligations that healthcare professionals are subject to. Okay, so to understand how moral conflicts can rise to the level of a moral dilemma, it's helpful to examine different kinds of moral requirements. So two kinds, negotiable and non-negotiable moral requirements. Contemporary philosopher Lisa Tessman describes the nature of moral requirements and their relation to moral conflicts and dilemmas. In fact, most of the ideas in this talk should be credited to Tessman's groundbreaking work in examining morality's limits in impossible situations. So first, some moral requirements are negotiable. If a person has an obligation to do A and to do B, yet both cannot be fulfilled, one requirement may rise to the top and cancel out the other requirement, or the person may be able to compensate for the unfulfilled requirement. For example, say you have a patient who expresses that they may harm themselves. As a provider, you have a duty to protect the confidentiality of your patient. However, in cases of express self-harm, you have a duty to disclose private information in order to protect the patient. You're always bound to act in the best interests of your patients. In this case, you're faced with a conflict that can be resolved. Clearly, the duty to protect the well-being of your patient overrides, rises above, perhaps even cancels out the duty to maintain privacy. The greater good is apparent in this conflict. Consider another example. Say I made a promise to meet a friend for lunch. Before our scheduled meeting, I get a call from my son's school that he's sick. I'm faced with a conflict. I have an obligation to keep my promise, and I have a duty to fulfill my obligation as a parent to care for my child. In this situation, I break my promise, right? Caring for my child rises above the promise to my friend. However, in this case, I can make up for the failure, right? We can reschedule lunch. Okay? So that's some ways of looking at what we mean when we talk about moral conflicts and how some kind of moral requirements can be negotiated, okay? Now, in contrast, we have moral requirements that are called non-negotiable, which means that when both obligation A and obligation B can't be fulfilled, the person is subject to an impossible choice where one can't fulfill the moral requirements. In the case of a moral dilemma, a person is subject to non-negotiable moral requirements. Recall the clip from Sophie's Choice. Sophie is given a choice to choose between her two children. Which one will die and which one will live? Sophie has a moral requirement to protect and save her daughter. Sophie has a moral requirement to protect and save her son. She cannot satisfy both requirements. However, in Sophie's situation, we can see how both requirements are binding. They both remain in effect. The requirement to protect her daughter does not cancel or rise above her duty to protect her son. And her duty to protect her son does not cancel or rise above her duty to protect her daughter. The moral requirements that Sophie is compelled to fulfill are absolutely obligatory. She is forbidden to choose her daughter, and she is forbidden to choose her son. Sophie is subject to non-negotiable moral requirements that will inevitably lead to a grave loss of immeasurable value, right? Specifically, the loss of one of her children. That's probably one of the most tragic explanations right there. Okay, so the nature of the problem. Sometimes we are faced with no good options. Moral dilemmas are real and they can happen to us. Sometimes we don't have a right option to choose, so we must choose evil, and morality cannot guide us to the good. Every now and then, more frequently in healthcare, we can't fulfill morality's expectations because we are faced with impossible moral requirements. So again, think about Sophie's choice, think about Teetle, think about the trolley scenario, think about Dr. Brother's story. Now ask yourself, are these situations where you are required to do what is impossible for you to do? What does moral goodness look like in these situations? Is there any way we can avoid committing a grave, even life-threatening wrong? As healthcare workers, you all have a code. Do no harm. You may think that. Hello? Okay. You may think that do no harm will guide you. But what if it doesn't? Did I just hear that? Yeah. Okay, let me get. So you all have a code, do no harm. You may think that do no harm will guide you. But what if it doesn't? What if you cannot fulfill your oath and professional commitments to patients? Clearly, moral dilemmas illuminate the occurrence of moral impossibilities and reveal morality's apparent action-guiding limits. Cases where moral requirements become impossible to satisfy. Even though the ought implies can provision, namely morality cannot require you to do what's impossible for you to do, is morality's clear boundary. Even in situations where someone will inevitably die, morality cannot effectively guide us away from moral failure. Sometimes morality can't save us, but here's the thing. It denies that this is true, and we believe the hype. We believe we can reason our way out of the conflict and promote a favorable outcome. If we don't, we often think that we missed something in the reasoning process or overlooked some important piece of information. Indeed, many moral theorists reject the claim that morality cannot resolve conflicts and deny that genuine moral dilemmas actually occur. However, stories like Sophie's Choice and Teetle and Dr. Brother's No Good Options case provides real-life scenarios of what seems are actual moral dilemmas, where we can't find resolution and impossible moral requirements compel us to make an impossible choice to choose evil. In each case, we cannot reason our way out of the problem. We cannot escape. We're inevitably faced with a tragic choice to cause harm. So we must recognize that some situations offer no good choices. And in spite of that, we still have to respond and we still have to act. So the nature of an impossible choice. This is where we're at. Impossible choices arise as a result of genuine moral dilemmas. Situations where a conflict rises to the level of unavoidable moral failure. That is, moral dilemmas impose on us an impossible choice to necessarily choose a wrong. No matter what we decide, something of moral value will unavoidably and inescapably be lost. So where do we go from here? Well, I think impossible choices can teach us a lot about morality. So I hope to end with a little bit of hope about morality. So 3 lessons for for tonight moving forward. First lesson. We must better appreciate and understand morality's limits and the power of luck. As we have seen, some situations are an exercise in futility. The cards are stacked against you. Morality cannot divert you away from evil. Morality is difficult, and sometimes doing the right thing is beyond our reach. The situation is hopeless because the possibility of goodness is absent. Moral failure challenges our sense of self. When we fail as a result of an impossible choice, our decision does not make us bad people. And I think this is a really important thing to recognize. When you cannot win and when you cannot do the right thing, that is, no matter what you do, you will not succeed in fulfilling your moral commitments. This can harm our moral identities and unhinge us. In tragic circumstances, and when the stakes are high, morality appears to fall short. Utilizing good practical reasoning strategies and clearly rational moral principles may not be enough to guide us or protect us from inflicting harm on ourselves or others. Sometimes we can't reason our way out of a dilemma. If we do not have clearly good or morally correct options to select from, no matter what virtuous qualities we may possess, we may be unable to prevent moral failure. However, our moral failings are not a reflection of character flaws, but rather reveal the limits of our humanity in times of crisis and disaster. Second lesson, we must incorporate more inclusive and realistic moral language in moral education. We must recognize that sometimes the cards are stacked against us, and we lack the power to succeed in fulfilling morality's demands, no matter how hard we try. So life occasionally sets us up to fail. And I wonder, if morality can't guide us, then does morality betray us? I think we need a more discerning moral framework that incorporates and recognizes unavoidable moral failure and impossible choices can and do occur. We need a morality that recognizes that sometimes life is bigger than us, and tragic, no-win situations, while rare, test our boundaries as humans and as committed moral beings. More inclusive moral concepts like unavoidable moral failure and impossible moral choice are important in order to protect our ability to hope. If moral education does not recognize that some situations are tragic and demand that we choose among two or more evils, then we're going to be hopeless about the possibility of a moral goodness. Remember, think about the picture, cover slide, right? That's no good, okay? However, if we broaden our thinking about moral matters, then we will be better equipped when competing obligations constrain us. Most people are good people who act to promote a good life for themselves and for others and seek to cultivate a good society. An organizational structure with more rules and more procedures may not produce better decisions and actions. Rather, morality must be rejuvenated in a way that's more holistic and attaches greater importance, right, to our humanness. Sometimes good character and clear rules can't relieve conflicts, ameliorate burdens, or facilitate the achievement of our moral goals and good intentions. Good, virtuous people can know and understand the right thing, but factors beyond our control may not allow us to act on what we know is right. Morality can benefit and support us in times of struggle, but it also needs to make better sense of life's curveballs. Okay, third and final lesson. Integrate forgiveness. As we have seen, morality may not be able to combat or prevent moral failure in all conflicts. However, we can learn to recognize failure and our humanity. Indeed, the act of forgiving can help us realize the enduring possibility of a return to goodness. So an act of forgiveness is often captured in ideals of mercy, compassion, empathy, reconciliation, even amnesty. It is a response to a wrongdoing that does not seek to excuse or absolve a person of their moral failing, but rather helps us to let go of negative emotions and feelings towards others and towards ourselves. Some scholars argue that forgiveness may be able to aid in recovery when our moral compass cannot guide us towards the light or towards the right. Forgiveness can also help us to see certain kinds of situations for what they are, the presence of impossible moral requirements. We live in a cancel culture kind of world, where sometimes with one strike you're out. But even ethics recognizes the possibility of moral progress. We can get better, and we can do better, and we can do this for ourselves and for our communities. Perhaps morality's notion of progress can help us to carve out a greater understanding of the impact of life's challenges, crises, and inescapable tragedies, and how they affect our moral commitments. Forgiveness towards ourselves and others enables us to observe the moral wrongdoing for what it is, and can allow for the restoration of one's agency and sense of self that was harmed as a result of the moral failure and the inescapable and unavoidable loss of something valuable. Now, I don't mean to suggest that we have an obligation to forgive all moral failings for any reason whatsoever, but I think that forgiveness is an important resource in times of crisis and disaster. When doing the right thing is categorically and undeniably impossible, we must not cancel or judge a person's character or qualities on the basis of an impossible moral choice. We might consider forgiveness as a form of respect for persons, both for ourselves, such as self-respect, and for others. So effective decision-making in morality is not always a formulaic process. So I think it's important to work to cultivate our moral imaginations, to observe opportunities in spite of structural barriers. By developing our moral imagination, we can better recognize limits and discern the moral point of view, even when there may not be one. Crisis situations, impossible situations, can threaten to destabilize us and jeopardize our sense of self, our values, as well as our professional commitments. So we must attune ourselves to humanity. Thank you. A few questions? Yes. Anybody would like to ask any questions?
I guess kind of a half-baked question, but one thing I really like about the second variation of the trolley problem is that with the fat man is that sometimes it gets people talking about what your responsibility is for the death of that single individual in version 1, where he's lying on the track, and versus version 2, where you are actively shoving him.
Yeah.
And I wonder that, I guess I'm thinking about Dr. Brother's example and some of the, the healthcare examples that I deal with in my hospital. I just wonder about responsibility sometimes, I guess responsibility and authority in the decision-making process, whose moral failure, I'm using the term a little bit differently, but for that baby, for example, whose moral failure is it? I guess, is it healthcare teams for allowing that to persist, or is it the parents, because it's their decision? So who has the authority in decision making? It's going to help us answer whose responsibility it is. And I think I guess I'm just thinking about it a little bit, and maybe you can help me think about how that maps onto this moral failure fork in the road.
Right. No, that's really good. So when we think about moral failure, we make these assumptions that moral failure is either an active, something that you actively do, right? Cheadle actively drowned her child, right? Or it's an act of omission, right? You're passive, you don't do anything. And so in, say, Dr. Brother's case, right, there is that question, right? So the healthcare team, they're immobilized, right? They can't do anything, right? So does that make them, right? They're subject to an impossible moral requirement, right? It's non-negotiable. You must care for your patient, but you're bound to do so. When it comes to moral failure, right? I mean, the book that Tessman wrote and, these ideas relate to morality broadly speaking, right? But they relate to moral requirements. In healthcare, you're not just subject to codes of ethics, you're subject to professional obligations. You're subject to the law, right? And so there's a variety of different factors, a constellation of factors that come into play. So moral failure is even more grave than I make it out to be. And I think I did a pretty good job of making it pretty savage. So yeah.
Question I have is, I hear you proposing an expansion of sort of moral thought to be inclusive of this impossible nature of it. How do we make that a part of discourse? Because it feels like to me that's the hopeful part of this, to sometimes recognizing why I feel bad is recognizing why I feel bad. You know, I feel bad because that's normal.
Right.
How do we have that conversation without being unhopeful or giving into despair?
Right. Well, I think moral, having a moral holistic approach to moral education is important, right? I mean, because I've been teaching ethics for a long time to healthcare providers in various fields. And over the years, I just stepped back further from, we're going to provide you a formula so you're going to know the right thing to do, because I don't think that morality works that way. Morality provides us with clear principles, ideals, standards of conduct, right? Right and wrong, good and bad. Morality gives us all of that. We have this great toolbox, but morality does not really tell us how to use it. Right. So I'm of the view that, right is right and wrong is wrong, period. Okay. But we're different individuals. We're situated differently in the world, right? Circumstances can vary. And so sometimes we may rank values or principles in different ways, right? So I think that, in response to your question, if a moral education is going to offer us a better way of cultivating our moral sense, then we can respond better. But also to recognize that sometimes the formula isn't going to fit, right? And we may not have an answer.
I have one question. Does your ethical theory allow you to formulate or to factor in what making the choice does to the person who makes the choice? For example, you're told by the Nazis you have to kill these three guards, these three of whatever, or the whole town. The obvious thing is to do the whole town. You get ready to pull the trigger, and there are no bullets in the gun. You have to club them to death. What that does to you as the person who has to make the choice, should that be factored in the moral quandary?
Absolutely.
So you move from a utilitarian to a Kantian.
Right. Right. Yeah, absolutely. Yeah. When we talk about, the rightness or wrongness of an action, an action is something that a person performs, right? And it plays a really significant role in who we are, right? Our actions are reflections of our character, right? All things considered. And so, yeah, I mean, to incorporate a more robust moral psychology, an account of the person, right? So that's to that point of our humanity and our humanness, like recognizing that. So, thanks.
We have a question over here from the virtual world.
Oh, hi, virtual world. Okay.
The questioner asks, does the cultural expectation of heroic medicine contribute to the moral distress among providers?
That's a good question. Okay, ask me one more time.
Does the cultural expectation of heroic medicine contribute to the moral distress among providers?
The can versus ought.
I think you're going to be able to better field this question, but as a moral philosopher, I will say that that the the moral culture, especially in, you know, healthcare education for, you know, related to ethics is that we can give you answers. And that can be really tricky because,
Move closer to the mic.
oh, I'm sorry. So that there's the expectation that there can be answers, and so that providers can achieve these sort of heroic ends, and that does provoke distress, you know, but we never talked about that. You know, I mean, you know, we talk more about moral distress and injury and burnout, you know, over the past several years, and that's really important, and that needs to be part of that moral vocabulary, actually. I mean, I think that's a really good point. So I'm not sure that's a satisfying response, but. All right. Thank you, everybody.